Now, let's go into the posterior cranium, the posterior fossa malformation. So for the posterior fossa, the three main malformation in the posterior fossa, number one, you have your carry 1 and carry 2 malformation. Those are the first two. Carry 1 malformation, carry 2 malformation. The third one is the Dandy Walker malformation. Carry 1, like it says 1. This is how you remember it. 1. One part of your brain is involved. That's the cerebellar tonsil. Cerebellar tonsil. What happens here? This cerebellar tonsil is trapped in your foramen magnum. Once it's trapped in the foramen magnum, what happens? It impedes the flow of the CSF, the cerebrospinal fluid, from the area or the region of its formation where you have the choroidal plexus. These cerebrospinal fluid is supposed to flow through the ventricles all the way down to the spinal cord. So when it's trapped at the base of the skull where the spinal cord leaves the cranial cavity, it puts pressure on the flow. It puts pressure, external pressure on it, and many of the CSF gets trapped in the brain. It accumulates more in the cranial cavity. What does that cause? It can cause headache. It can cause pain. It can cause stiffness around the neck, muscle weakness, tinnitus, which is ringing in the ear, and they can also cause balance problems. Now, in some cases, this can be asymptomatic, but in most cases, it presents with a symptom that's been mentioned already. Now, carry 1 malformation sometimes can be associated with spinal cord issue. Remember, if this is the foramen magnum, this is your brain right here, brainstem, and your foramen, this is your foramen magnum, and the pons, the medulla continues at the spinal cord and it leaves into your vertebral column. If the cerebellum here, right here, the tonsil goes into where the spinal cord is, let's say this is your spinal cord. If the tonsil goes in here, cerebellar tonsil, this is spinal cord, well, guess what it does? It puts more pressure here and it pushes the spinal cord on the outside and puts pressure on it, and the cerebrospinal fluid that's supposed to flow freely becomes trapped here and it flows slowly. That's why I mentioned it impedes the flow of the CSF. Now, if it accumulates more here and it flows slowly down, that's why you have the pain, the stiff neck, the headache, the dizziness, the ringing in the ear, because remember, and the balance problem, because the cerebellum is the center for coordination and balance. So there's much pressure here. Now, if it's at this level or at this level, the foramen magnum, guess what that can lead to? It can lead to syringomyelia. Syringomyelia. Syrinx, like syringe, which is tube, cavity, like a cavity. Myelia means spinal cord. So what's that telling you? Formation of a tube-like cavity in the spinal cord, or something that looks like a syringe in the spinal cord. That's a cavity. The spinal cord is not supposed to have a cavity like that, but because of the entrapment, that can happen. So this is what happens with Chiari 1 malformation. Now, Chiari 2 malformation, 2 parts of the brain, 2 structures of the brain, cerebellum, which is the tonsil, and the vermis in some cases. The second part is most likely the medulla. That's what's closest to the foramen magnum. Because at the basal part of the brainstem, you have your midbrain, which goes into the pons, which goes into the medulla and continues at the spinal cord when it leaves the foramen magnum. Now, your cerebellum and your medulla can be trapped in the foramen magnum. Foramen magnum, all right, you have your medulla here, your medulla, and then you have it living as a spinal cord. That's how it's supposed to be normal. in a normal time. Now you have the medulla drops into the space together with your cerebellar tonsil. Both of them are here. The two structures are here. It's supposed to be only one, two. Now it's two. It's putting pressure here. These can also lead to the formation of the cavity or the syrinx, just like in type 1. That cavitation known as syringomyelia. It presents with similar symptoms as KRI1 malformation. Your headache, your stiff neck, the dizziness, the balance and coordination problem, the tinnitus, all of that. Now, there is more other structural defect associated with this. You have myelomeningocele, you have syringomyelia, and also hydrocephalus. What does it mean? Hydrocephalus, fluid accumulation in the brain or the cranial cavity. Hydro, water, fluid. Cephalus, brain, cranial cavity. All right. Syringomyelia is one. Hydrocephalus is two. The next one is myelus meningocele. What does myel mean? Spinal cord. Meningocele, meninx. The meningomata, the meninx that covers the brain or the spinal cord. Now you have seal, that's water. Myelo meningocele, fluid accumulation. So, but these three structural defects is associated with Chiari-2 malformation. So let's talk about the Dandy-Walker malformation. What does that mean? The Dandy-Walker malformation is as a result of agenesis or hypoplasia of the cerebellar vermis. Okay, agenesis or hypoplasia. Also, you can say absence of the full formation of the cerebellar vermis. This leads to a cystic enlargement of the fourth ventricle. Now, when you look at the CT scan of people with this, there's a cystic enlargement inside where you have the cerebellum. Now, with Dandy-Walker malformation, agenesis, remember this, agenesis and hypoplasia of the cerebellar vermis. Cerebellar vermis. That leads to what? The cystic enlargement of the fourth ventricle. In some cases, this can lead to hydrocephalus. When there's hydrocephalus due to this, then it can lead to other symptoms like headache. You have intellectual disability, developmental delay. These two things usually occur in so many of the malformation with children. Also seizures. When the cerebellum is involved, you will see balance and coordination issue. Some cases, there will be motor dysfunction or motor delay. There can be hypotonia. There can be signs of hydrocephalus syndrome, because usually when there's that pressure from the fluid in the brain cavity or the cranial cavity, when that fluid surrounds the brain and put pressure on the brain, there can be headaches. There can be triggering of nausea and vomiting, blurry vision, motor dysfunction, etc. These are the things that you see with Dandy-Walker malformation. Again, remember, it's associated mainly with hydrocephalus, fluid accumulation in the cranial cavity. Now, let's go and discuss in detail syringomyelia. Now, syringomyelia has been mentioned many times with Chiari-1 and Chiari-2 malformation. What is syringomyelia? Like I've explained before, syrinx, myelia. Myelia is spinal cord. Syringo, that's your tube or cavity formation that looks like a syringe used in the hospital. You will see that cavity form in the spinal cord. What usually happens is these affects mostly the spinal thalamic tract. Yes, spinal thalamic tract, meaning spinal cord and thalamus. That's an ascending spinal tract. That's why it's called spinal thalamic, meaning it goes from the spinal towards the thalamic, towards the thalamus, towards the thalamus. This is responsible for pain and temperature. The first thing that happens is what? It causes a defect in the anterior fiber commissure, which leads to the spinal thalamic tract lesion, which now affects what? The pain and temperature. There's a loss of pain and temperature. It's usually common between the C2 and the T9 of the spinal cord. All right, between the C2 to T9, C2, cervical, thoracic, T9. Then it comes with something known as what? The cape-like syndrome, where it affects your neck all the way to the middle of your chest, the shoulder, your arm, your forearm, and your hand. There will be loss of pain and temperature in these regions. So with syringomyelia, as the Chiari malformations keep getting worse, the loss of pain and temperature keep getting worse also. And this can even progress from the side, where you have the spinal thalamic tract towards the anterior horn of the spinal cord. That's where you have your corticospinal tract, which helps in the controlling of what? Your motor function. This connects to the cortex, the area or the region for motor function in the brain, under the brain cortex. Again, if these syringomyelia keeps getting worse, it can affect the anterior horn, where you have your corticospinal tract. Look at the name, corticospinal. Cortex to spinal, meaning what? It's a descending tract. It goes from your cortex down into your spinal, as opposed to the spinal thalamic tract, which is what? Ascending tract. It goes from downward from your spine to the thalamus. So with the corticospinal tract or the anterior horn being affected by a progressed or progressive syringomyelia, what occurs? You develop motor dysfunctions, especially your lower motor neuron syndrome. So this is the information about syringomyelia. Remember another name for that, cape-like syndrome disease or defect. Now, even though we've mentioned Chiari 1 and Chiari 2 as the most common cause of this in this topic, other things that can cause that is tumors can cause that, infections can cause that. All right. These two things can also take part in causing syringomyelia. So that's all we have for you today. Remember, the posterior malformations. We have three. The posterior fossa malformation. You have your Chiari 1 malformation, Chiari 2, and the Dandy Walker malformation. All right. For your brain malformation, commonly, you have number 1, lissencephaly, number 2, holoprosencephaly. These are the common ones. So let's stay tuned. More information coming your way. Dr. Emmanuel, Medical Bellator.